And I'll introduce for you the technique that I like so much, that is the mesotoxin, with a great skin quality and many other benefits that I'll share with you. My name is Mariana Correa. It's my first time this year here in BTS. A big pleasure for me, and thank you for everybody. I'm a dermatologist from Brazil, in the capital, and I have my clinic in Brasilia, in the capital, Brasilia. So far from here, but it's a big pleasure to be here. I'll share with you this first case of my patient of 50-year-old. Before, I'll share the video of the technique that I use in my patients, like the mesotoxins. This is the before and after, 15 days after. And how many procedures do you think that this patient did? Only one, microtoxin, and she didn't did another procedure. So this is a technique for a lifting face and for the skin quality, the pores, the lines of the neck, so she was very happy. This is an article that I like so much from a friend of mine from South Korea. He is Kyo-Hoo. And in South Korea, people love to do the mesotoxins for the skin quality and not to have an artificial treatment, but it's a natural treatment for any patients. This is a technique for a lifting that I like so much, the jawline lifting. So he used 2 units of microtoxin invited per point, and a total of 20 units of botulinum neurotoxin per side is injected. So you can take a picture of this article, that it's a great article about this technique for facelifting. And here, another article from this great doctor too, Dr. Sabrina, that it's some techniques that use some points of microtoxin, for example, in 0.5 in the mid-face and 1 unit in the lateral face. So these points for a facelifting and for the skin quality too. And here about the microtoxin, about the dilution, that it's very important. The dilution always, it's about 5 units, and some people, they use 2 units too. So it depends of the doctor. And the injection is intradermal, not like the traditional botulinum toxin. And here, another benefits that you share too, it's about acne, melasma, some patients like too, hyperhidrosis, keloids, pores, and rosacea, and another benefits for the patients. And here, I'll share with you the technique of that patient that I'll share with you, that she has 50 years old.
In my technique, I use the traditional botulinum toxin over the C-line and at the glabella. In the lower frontalis and the lateral face, mid-face and the lower face, microtoxin for lifting and for improving the skin quality. And here in the contour and on the neck, microtoxin to improve the lines and the texture. So you can see many points here. The microdroplets of 0.5 units are injected in the intradermal layer, the lower forehead, as superficial as possible. With 1 centimeter intervals, deeper fibers of the muscle will not paralyze, with more natural appearance, a brow lifting effect, and less complications such as ptosis. Very superficial. And here, I inject in the orbiculary area, microtoxin to open the eyes and reduce the wrinkles. In the mid-face, 0.5 units to reduce the pore size, the melasma, rosacea, and for purpose of increasing skin luminosity. On the lateral, I use points of 1 unit, and the lateral 2, these points will improve the lifting effect. And here, on the lower face, I usually inject 2 units in each point for a face lifting effect and for the contour. On the neck, many points of 1 unit superficially to improve skin texture, and fine lines will raise. And we can see little blebs superficially all through the neck lines. I use like 50 injection points per side, and in the middle of the neck too, to improve the skin quality. So you can see very superficial.
So in the neck, many points of injection and very superficial to have a great. You can take a picture if you want of these points that I use in this patient. And I used to individualize each patient, so you need to observe each phase of each point that you need to do. And here, another article that I like so much, it's the technique that I use in the lower eyelid, doing the injection of the microtoxin with hyaluronic acid, the pure one. Some cases I use the NCTF, that they have a lot of benefits like vitamins too. And here, I'll show this video using this technique.
This video shows the technique of mesotoxin that I use in the lower eyelid. The combination of microtoxin with pure hyaluronic acid and vitamins. I mixed 10 units of botulinum toxin with 40 units of NCTF in a 50-unit syringe with a 30J needle. The most recommended technique for this kind of procedure is to make the injected droplet smaller and more superficial. 25 points in each lower eyelid. I inject 1 unit intradermally in each point for dermal hydration and skin rejuvenation. Before the procedure, I used topical lidocaine as anesthesia. The patient told me that she didn't feel any pain. It's a good technique to improve the skin texture of lower eyelid. You can achieve better results with 3 sessions, and the downtime is very good.
It's very good because the downtime is so safe. And here you can say the technique that I used. I mix the microtoxin with NCTF, or you can use another one, but this is a pure hyaluronic acid with many benefits like vitamins to improve skin quality, the collagen biostimulator. And here, I'll share with you this technique, this before and after of this patient from the video. And here, 30 days after, you can see the lower eyelid and the improvement of the forehead too, and the skin texture. And here, the improvement of the lower eyelid and the skin quality, hair pores that are very better. And another case of this patient 20 days after, that you can see the luminosity of the skin for many points that I use in the microtoxin, very superficial. And here another that you can see the eyebrows more symmetrical, because she had a symmetry in her eyebrows. And she shared with me, oh, now my eyes are much more beautiful, and I have a great appearance. And more elevated brows, more youthful eye appearance too. And here, who is this patient? My grandma, that I love so much. She has 88 years old, and she told me, oh, Mariana, I need to do a treatment for my skin quality and for my wrinkles. So I did the mesotoxin at her, and this is the 30 days after. So she maintained her movement, nothing artificial, and she was very happy because her eyes are opened and the skin quality is more great. And here, another technique that she shared, the Ogilvy, it's not Patricia, I forgot. And the contour, that you can see some points of the contour in the neck, the platysma too. This other technique that I show in the video is the more reduced pores in these patients that I inject some points, the luminosity skin, and the lifting effect too, that is very natural. And here, a patient of mine that I take care of 3 years, and she'll share her.
Botulinum toxin with the other professionals before, but your technique is the best one for me because open my eyes and my eyebrow is much more beautiful.
So the patients, they like so much the natural results. For me, in my opinion, mesotoxin, it's not just about wrinkles. The ultimate goal is to enhance each beauty, and it's good to pay attention to each details of the patients. Respect and appreciate each individuality. Your patients will love so much. Thank you. And this doctor, Dr. Arthur Switz, he loves the details, and I did some techniques with him, and he explained, beyond the obvious beauty, individualized optimizing with botulinum toxin. So individualized with many details to have a great result. Thank you so much for the attention.